Hyperplastic polyps, like these pale, shiny donuts in the rectosigmoid, have no malignant potential. With air insufflation, they flatten out and become less obvious, so they've been called disappearing polyps. Hyperplastic polyps in the proximal colon are bigger and look brownish because of bile staining. The bile washes off easily. This typical lipoma in the ascending colon, rounded and shiny, indents with forceps palpation the pillow or cushion sign. The ileocecal valve is also enlarged and lipomatous. This small yellowish elevation moves around on palpation. Snared off, it proved to be a lipoma too. Yellow submucosal lesions in the rectum, firm to palpation, are usually carcinoids, entirely benign but easy to snare off for peace of mind and histology. Here's another typical carcinoid. Because of its shiny surface, this polyp doesn't look like an adenoma. It proved to be a hamartoma on histology. This tiny polyp, multilobulated and with slough on the surface, is typical of a juvenile polyp, an incidental finding in old age. This large juvenile polyp shows the same slough-covered surface. The pathologist may describe it as an inflammatory polyp. Here's another, probably not an adenoma because it's so shiny, and it was non-neoplastic, juvenile histologically. This is a rarity. A shiny, lipoma-like cystic elevation. It won't aspirate down, so it's partially snared at the top for diagnosis, which releases gooey fluid. It's a lymphangioma and needs no further action. Another small, shiny nodule, obviously not an adenoma, proved to be a neurofibroma. A shiny, medium-sized but firm polyp, snared off, and there's white tissue in the severed head, a leiomyoma. Finally, in retroversion at the anal margin, a fibroepithelial polyp of no consequence. Leave it to the proctologist.